Hi, I'm Dr. Joe Manfrida, Chief of Laboratory Support Services for the Arizona State Public Health Lab. My role here at the lab includes acting as the head of safety and biosecurity. I've been given the honor of speaking to you today about the biosafety countermeasures we put into place at the Arizona State Public Health Laboratory to prevent widespread COVID-19 illnesses in our staff during the disease's initial surge. It is a general policy that all presentations given by Arizona State personnel are preceded by a disclaimer indicating that this presentation reflects my own ideas and opinions. I am not a representative of the entire state of Arizona government system, nor do I represent any of the federal agencies which fund our department. If you want to reach out to me, please feel free to do so. I will be giving out my email at the end of this presentation. Interestingly, for comparison, what you see on the right-hand side is a photo of myself that was pre-COVID surge. So you'll get to see what I look like now at the end of this presentation. That was shortly before the surge, so we'll see what happens. Here's a brief outline for my talk today. I'm going to be making the case that, at least for us at the Arizona State Public Health Laboratory, our experience in dealing with the impact of COVID-19 can be defined by 4 factors which sometimes worked at cross purposes. I'll be using examples to illustrate the experiences of our ASPHL team, and then I'll go over some of the lessons learned. It's my hope that you will be able to take some of the principles learned here at the State Lab and apply them in your own work, because it's always better to learn from someone else's mistakes, right? So here we go. Early in the pandemic, there were few commercial laboratories in Arizona which had COVID testing capability. As a result, the primary problem for the Arizona State Laboratory was the necessity to operate 7 days a week to provide COVID-19 testing while dealing with the inevitable reality that we would be temporarily losing people as they became sick. During the height of Arizona's pandemic surge, we were testing hundreds of specimens a day and hosting testing events in our parking lot. On testing days, it was not unusual for the lab to receive over 500 specimens, all of which needed to be accessioned into the laboratory's computer system by our receiving team before being tested by our microbiology team. At the onset of the surge, several concerns became apparent. We'd have to have testing running for 7 days a week to meet demand. COVID-19 was highly contagious and could easily spread throughout the laboratory, knocking out staff when we needed them the most. Since there was little available commercial testing during the early part of the surge, if the laboratory was crippled by personnel loss due to COVID, our testing and other essential services would not be available to the citizens of Arizona. Countermeasures had to be deployed to maximize the number of healthy staff at the state lab during the pandemic. This is a confusing slide. It is illustrating what eventually turned out to be a very confusing set of issues that we had to deal with. So these 4 important factors had to be taken into consideration when deploying COVID countermeasures. These were biosafety precautions, engineering and facility-based precautions, psychology, and law and regulation. These 4 factors sometimes overlap and at the same time often have differing requirements. The task that confronts any safety officer is to balance these requirements and conflicts to produce an optimal set of countermeasures to protect laboratory staff. Let's take a look at each of these factors separately before seeing how they interact with some of the challenges we faced at the Arizona State Public Health Lab. Those of you who are familiar with biosafety will recognize immediately that it is a very broad topic which can encompass all aspects of activity on a work site, including engineering controls and behavior. However, for the purposes of what I'm talking about today, when I refer to biosafety, I am specifically referring to biosafety practices that we already had in place before the COVID surge event. These items included our normal procedures for maintaining safety, standard response protocols to spills or exposures, and the use of personal protective equipment. When I speak of biosafety in the context of today's presentation, I am referring to our normal day-to-day operations and how we had to change them to deal with the COVID-19 pandemic surge. A well-designed biosafety plan can be scaled and modified to adapt to novel risks. Evaluation and optimization of the biosafety plan should be a standard response to any emerging threat. As a safety officer, I think it's safe to say that most of us tend to initially overreact a bit to novel safety threats. A safety officer's first instinct is to insist that everyone use the most strict and severe safety precautions when dealing with a novel threat. However, it's important to remember that overprotection can be every bit as bad as insufficient protection. For example, while issuing sealed protective suits to everyone working in the lab would indeed protect them against the spread of COVID, the suits themselves are a threat to staff safety through reduced agility, poor situational awareness, and the exhaustion of working in heavy protective garments all day. Safety officers must balance protection provided by safety equipment and procedures against the problems caused by adding precautions. Please keep this principle in mind when we discuss examples of the challenges faced by the state lab. Engineering controls are usually discussed in the design of laboratories to prevent contamination of specimens being worked with or exposure of staff to those same specimens. For the sake of dealing with the COVID pandemic, I'm expanding this definition a little bit to include those arrangements in the building which can help prevent the spread of contagion between staff workers. The Arizona State Laboratory already included a number of contamination countering precautions, such as HEPA-filtered air and readily available sinks for hand washing. Because it has a primary function as a laboratory, we actually had some things already in place. In response to COVID, a number of countermeasures were put into place which enhanced pre-existing precautions, such as the arrangement of public spaces, signage, and distance indicators. Frequently, these precautions are time and cost efficient if ways can be found to leverage pre-existing resources. Law and regulation can make the implementation of countermeasures difficult. Management at the laboratory has a legal requirement to take actions to ensure a reasonably safe work environment for lab staff. At the same time, workers have legally binding rights which can't be violated without incurring legal penalties. Furthermore, there are organizational rules on what can be asked of workers. There are many situations where something may be legal to do, but violates high priority internal directives for the organization. I highly recommend getting to know your contacts in your legal and human resources departments if you find yourself in this situation, because they are your best friends for these kinds of things. A good legal and HR team can review your plans before they are implemented and help you navigate these sometimes tricky situations. Our final category is psychology. The implications of your countermeasures for human psychology must also be considered before and during deployment. It's important not to create fear in your team. People who are afraid refuse to report for essential activities, and stress can actually increase the chances of laboratorians committing errors in their work. Deployed countermeasures should be both effective and psychologically reassuring. Team members should understand that the countermeasures put into place are for their safety and that management values their well-being. These are implemented in a fashion which reassures the team that all team members are valued equally and that no team member is valued more highly than another. The appearance of favoritism between work groups can lead to greater stress and work problems. Also, be aware that visitors to your facility should be considered as well. If visitors to the lab experience anxiety due to the countermeasures, this can lead to negative publicity and impact ongoing work. This is particularly important for government organizations which are under public scrutiny and regularly receive visits from elected officials. So those are the four basic categories. Let's see how these categories played out with some of the challenges that we faced early in the pandemic surge. Now, prior to the announcement by the CDC recommending cloth face masks for the general population, members of the state lab brought suggestions for universal masking to the Laboratory Safety Committee. I am actually the head of the Laboratory Safety Committee as well, so this came straight to me. And the committee thought about this, and from a pure biosafety-centric perspective, this suggestion to provide N95 respirators to all personnel, or at least to ones who interface with clients from outside of the laboratory, was initially intriguing. However, there are a number of good reasons not to implement this suggestion. N95 respirators can be taxing to wear for long durations. Even someone who has passed a mask fit test to confirm suitability to wear an N95 can experience significant fatigue when breathing through one for extended times. Requiring some or all staff to wear N95 respirators for an 8-hour workday potentially could cause physical harm. Additionally, the laboratory did not possess enough N95 respirators to equip all personnel and could not acquire enough to provide for everyone over a protracted period. The emotional impact of providing respirators to some staff over others was considered potentially damaging to team morale during a time when top performance was needed from all staff. Finally, there was a concern about the legal and regulatory implications of requiring personnel to wear respirators. The state of Arizona typically works to ensure the rights of the individual for all members of its workforce. The proposal to require universal masking was not an industry standard at the time and raised concerns regarding as to whether or not a mandate would be violating state rules. The CDC did eventually release its masking recommendations shortly after these proposals were brought to the Safety Committee. Arizona's county and municipal governments issued masking requirements, and the Arizona Department of Health Services used the CDC recommendations to craft a department-wide policy shortly thereafter. The ADHS policy required the use of disposable or cloth face coverings for employees required to report to duty on site. Implementing the ADHS masking policy was relatively easy for the state laboratory, as we had a significant supply of disposable masks to distribute. Having an official policy eliminated concerns regarding the legality of making people wear masks as a mandatory thing. The policy was strongly embraced by ASPHL staff, many of whom brought cloth or disposable masks from home. Voluntary compliance eliminated many of the concerns surrounding the psychology of requiring masking, since disposable and cloth masks were in ready supply and could be distributed to all staff. Now, the sight of all the laboratory personnel in masks did cause some initial anxiety with our external partners who were not aware of the county and municipal mandates. However, this was quickly resolved when the mandates were explained to our partners. Our second example deals with entry screening. Departmental mandate largely resolved the question of how to implement masking at the state laboratory. However, the same mandate for masking had a second part which mandated entry screening, something which had only been considered briefly prior to that point in time. Entry screening functions by looking for signs and symptoms of COVID-19 as well as potential exposures. The process uses a questionnaire to ask about persistent coughing, prior exposures to COVID-19, and an infrared touchless thermometer to check for fever. Screening is heavily impacted by federal and state medical privacy laws. The information gathered, name and presence or absence of symptoms, includes both personally identifiable information and medical information, and as such is covered by HIPAA regulations. In order to ensure compliance with all legal requirements, a number of strong limitations on screening were initially put into place. First, screening was only to be performed on contractors and visitors. This ensures that the privacy protections given to state workers are not infringed upon by their employer. Second, screening was only to be performed by the chairperson of the Safety Committee. This limited the number of individuals potentially exposed to putative carriers of the disease and also reduced the number of people with access to HIPAA-covered information. Screening was conducted in the laboratory's front lobby, and records were stored in a nearby laboratory which could be kept locked. These initial restrictions eventually had to be modified to accommodate the realities of regular screening. A number of laboratory staff requested periodic temperature screening of their own volition. This was granted upon request as ADHS policy supports voluntary self-monitoring, and using the laboratory's touchless thermometer gave staff a means of doing so. It was also necessary to train additional staff to perform screening, as screening volume was sufficiently high enough that the chairperson of the Safety Committee could not perform all of the screening necessary while maintaining their other duties. Additional screeners were selected from volunteers with prior experience in working with HIPAA-covered information and in wearing the PPE necessary to protect them from potential exposure. Overall acceptance of the screening process has proven to be high, though there is the occasional recalcitrance on the part of some individuals has been noted among a small number of visitors. However, since visitors are not required to enter the laboratory by ADHS, this has not led to a legal challenge of the screening practice. Additional precautions were enacted through the laboratory facilities team, which helped to reduce potential transmission of COVID-19. These took the form of engineering controls or sanitation controls. Engineering controls are those physical adjustments and barriers put into place to ensure physical distancing, while sanitation controls are those adjustments made to our regular cleaning schedule to help reduce the spread of contagion. These activities had the advantage of posing no significant legal problems and having sufficiently low resource requirements that they could largely be enacted easily and quickly. Our facilities and safeties teams were notified of the need for these changes on a very short notice before a major testing event in the state lab. They rose to the challenge and implemented our controls in less than 3 days. Physical changes to the laboratory enacted to promote physical distancing included reducing the number of chairs in public areas and spreading out those that remained. This was particularly important in the lunchroom and break areas to ensure staff could safely remove their masks to eat. For areas of the laboratory where staff interact with outside visitors, tape demarcating 6-foot distances between the visitor and staff were marked on the floor. Tape markings were especially effective in the receiving laboratory, where staff were required to interact with couriers bringing testing specimens to the lab from hospitals and medical centers. A 6-foot mark allowed receiving staff to stand back from the receiving window while couriers loaded shipments and documentation onto the receiving counter. Pass-through refrigerators and shelves were also utilized to move specimens and media from the receiving lab and the media preparation lab to testing laboratories without staff having to interact directly with one another. Where this was not possible, refrigerators were located in remote areas of the laboratory, with specimens being dropped off by receiving team members. Specimens are later retrieved by testing laboratorians after being notified of the available specimens by means of an intercom system. This also prevented unnecessary contact between testing and support team members. Janitorial services were doubled to allow for regular cleaning of commonly touched areas such as door handles and bathroom fixtures. In order to ensure the safety of staff, auditoriums are cleaned after testing events or any other event which attracts large numbers of visitors to the laboratory. Implementation of engineering and sanitation controls were rapidly accepted by laboratory staff, but met with some psychological issues from outside partners and clients. Couriers were initially surprised at ASPHL's physical distancing precautions, and it was necessary to allocate time to explain our methods to those couriers who reacted negatively to our precautions. These issues were resolved by explaining to the individuals why the precautions were in place and reassuring them that they were for the protection of both our staff and visitors. Similar psychological challenges required that some of the remote drop-off refrigerators needed to be moved from their initial locations in order to remove them from the line of sight of visitors and other non-laboratory staff. The refrigerators were kept in appropriate biosafety areas of the laboratory, but the sight of refrigerators marked with biohazard signs caused anxiety among visitors who were not familiar with laboratory operations. Moving the specimen drop-off refrigerators so that they were out of sight of visitors removed this issue while allowing us to continue using remote drop-off locations for specimen distribution. Some of the most effective methods of preventing the spread of COVID-19 are directly related to the behavior of individuals. Educational signs placed throughout the laboratory encourage hand washing, self-monitoring for symptoms, and physical distancing. Notably, physical distancing has been recommended as a central practice to COVID prevention by the CDC. ASPHL explored a number of ways to promote physical distancing. As previously mentioned, ASPHL reconstructed public areas and set up tape indicators to accommodate distancing. However, one of the biggest changes was cohorting. Cohorting was implemented to divide state lab staff into work groups that could avoid interacting directly with one another. In order to reduce potential exposures, all non-essential personnel were encouraged to work from home. However, in the laboratory, this accounted for a very small portion of personnel. Obviously, laboratory workers should not be taking their work home with them. To protect remaining essential personnel, laboratory staff were divided into functional cohorts, thereby limiting contact between various testing teams. In order to provide surge testing 7 days a week, it was necessary to further break the microbiology cohort into separate teams. Each team works in the laboratory for 3 days a week, with teams trading off working in the lab on the 4th day or working from home. Cohorts try to avoid direct contact as much as possible, working in different parts of the lab and exchanging materials through pass-through refrigerators or drop-off areas. Now, unfortunately, not all of the functional areas of the lab have sufficient personnel to break them into alternate teams over a full 7-day week. In particular, receiving does not have enough personnel to establish rotating, non-overlapping cohorts. For these teams, it has been necessary to carefully schedule flexible work times for personnel, with schedules being altered as needed to ensure staffing for all 7 days in a week. It is also very important to prioritize work when staffing is limited and surge specimen intake is high. High-priority specimens need to be accessioned and sent to the testing laboratories as quickly as possible, while less critical specimens can be delayed for later testing. These significant changes in how work is conducted initially caused some concern among employees. Requirements to work from home or work on weekends or being asked to work on a flexible schedule is a dramatic change from what most workers are accustomed to. Careful and thorough explanation and a willingness on the part of management to communicate the necessity of these changes to the laboratory team has helped Arizona State Public Health Laboratory staff adapt to the requirements of COVID-19 surge testing. Our team members fully embraced the changes being made when provided with our detailed strategy for the COVID-19 surge. And that what you just heard is our PA, or public announcements system, about earlier. Sorry about that interruption, but not a whole lot I can do about it. Okay, so those are some examples. What are the take-home lessons from this? There are essentially 4 big lessons. In learning from ASPHL's experiences in dealing with COVID-19 surge, a number of general concerns and strategies to counter those concerns became apparent. An organization's legal and human resources departments are invaluable resources when an organization is forced to implement dramatic changes. Anytime normal work behavior needs to be changed dramatically, whether that's requiring new behaviors, working time, or dress code, it helps to know that you have teams specialized in determining what you can and can't be legally asked of an organization's workers. This helps to reassure management that they are not opening up the organization to a lawsuit, as well as reassuring staff that management is taking the time to think about protecting their rights as well as the health of the organization. Open communication is a key to implementing change. Most staff members understand the needs of their organization in a general sense. Laboratory staff in particular understand that their jobs will sometimes require unusual hours, schedules, and activities in response to major outbreaks or incidents. Keeping staff members informed of what is going to be asked of them as soon as possible and the reasons for doing so has helped ASPHL to maintain high worker engagement even under challenging circumstances. Team members enthusiastically embraced the surge response changes as they represented a chance for the team to perform its duties to the highest extent possible in a circumstance where their talents and skills were most needed. Significant and impactful COVID-19 precautions can be implemented with little overhead investment through the creative application and modification of pre-existing resources. This can be implemented through rearranging common areas, setting up no-contact materials exchange points, and regulating traffic flow through a facility. Flexibility in scheduling is a key tool for surge response, both in ensuring adequate staffing for performing tests, but also for ensuring that physical distancing can be maintained. Implementation requires close cooperation between managers and supervisors to ensure that staff qualified to perform a variety of required testing are evenly distributed throughout the work week. Overall, I'd say that our precautions at Arizona State Public Health Lab have been largely successful. We have been able to keep the state lab functioning and providing vital services 7 days a week since the beginning of the surge. We have been very fortunate. We have had very few illnesses, and the only significant casualty has been my beard, which you can see in this photo. This is me after the surge happened earlier this year. Now, I'd like to give you the opportunity to ask questions, and if you think of questions you'd like to ask me later, please feel free to do so with the contact information I have right here. I'm totally willing to accept both phone calls and emails.